What is it that happens when your brain loses its connection with the body? So we are going to look at what we call sensory reeducation. So within your brain, we have what we call the sensory homunculus. So in conditions such as neuropathy and phantom limb, the connection between the brain and the body is lost. So within the sensory homunculus, that is the body's map within the brain, every body part is represented. There's a representation of every part of the body. So in case of an injury to one part of the body, for example, in amputation, whereby this, let's say amputation of the upper limb, whereby there's loss of the upper limb. Let me use the elbow joint, amputation of the elbow joint. So there's loss of that limb. However, the sensory information still is within the brain. So what happens is that your brain still has the map of that area and it still fires. So it still sends signals to that part of the body, even in its absence. So what happens is that at times you'll be able to feel pain, or you'll be able to feel as if the missing part that was amputated still exists. So that is what happens within the sensory homunculus. The brain has that map, and that map is what will lead to that sensory disturbance. It will lead to that pain. Commonly in the phantom limb, those who have undergone amputation, and also in cases of neuropathy, whereby there is damage to the nerve cells. So with the sensory reeducation, there is remapping of the brain. Certain activities are done to help remap and reconnect, to help bring back the connection between the sensory cortex and the brain. So this has three pillars, that is localization training, we have texture discrimination, and graphesthesia exercises. So with the localization training, this is whereby the point where you feel that pain, it is being touched. A stimulus, that is tactile stimulus, is provided at that point whereby you feel the pain, and then you are asked to identify where you feel the pain without looking, whereby you feel the sensation without looking. This is very integral in bringing back the connection between the sensory cortex and the body. That is for localization training. Then we have texture discrimination. This is whereby you move from hard texture to soft texture. For example, a rough material can be placed within the skin, then from there you proceed to a soft one. This also helps in the sensory education, whereby you can be able now to differentiate between the rough and the soft. Then you have the graphesthesia exercises. So this graphesthesia involves the letters. So this is whereby letters are drawn in different parts of the body and you are asked to identify. They are drawn without you looking at the area and you are asked to identify. Your ability to identify those letters will also help in the sensory reeducation. So we have three: localization training, we have texture discrimination, and graphesthesia exercise. So these always require consistent gradual sensory loading. They usually require consistent gradual sensory loading. So consistency is the key, and restoring the neural image is the main goal. The main goal is to restore the neural image. Then when it comes to the phantom limb has a paradox in that managing it somehow is hectic, and therefore we apply the mirror therapy. So this is whereby through the mirror you are able to visualize the missing limb. What happens is that a mirror is placed in front of you, and you are now able to visualize the missing part of the body that will be able to send signal to the sensory cortex, informing the cerebral cortex that the part is missing. Another way in which the phantom mirror therapy occur is by use of the mirror box. For example, you will place your hands in a mirror box, and as you place your hands in the mirror box, you move the active, which is the arm that is present, and through the mirror you'll be able to see two different arms, which will also be able to send signals to your brain, and therefore will help in pain reduction. So phantom limb, that is reduction using mirror therapy, uses also the concept of the motor homunculus representation, that is the mapping of every body part within the sensory cortex, whereby the missing limb through the cerebral cortex, as it is mapped within the cortex, as you visualize that part, the signals will be able to be sent to your brain, informing the brain that there is a movement that occurs within the missing limb. Alternatively, if you are not able to visualize the missing limb, you will be able to visualize the absent limb, and as you visualize it, the visual feedback will be sent to the cerebral cortex to inform it of the absence of this limb. So with this, there's no overnight fix, and usually they require frequent sessions. With the mirror therapy, it may work wonders within the first time. However, it will always require frequent sessions. Same when it comes to sensory re-education using localized training, using Graphesthesia exercises, and texture discrimination. So they are not usually overnight fix. They require frequent sessions. So having the knowledge of how sensory education works is already power. So you should seek consultation if you have any problem when it comes to dealing with the neuropathy and phantom limb, and also other neurological conditions whereby there is disconnect between the body and the brain.